All right, our next chapter is Chapter 6, Late Pregnancy Bleeding. First, we're going to look at the differential diagnosis of late trimester bleeding. The most common cause is abruptio placenta. Abruptio placenta occurs in about 1% of pregnancies. Now, if we remember, there's 4 million births in the United States a year. That means that there will be about 40,000 abruptions. That's a fair number. Placenta previa is in about 0.5% of pregnancies at term. So abruptio placenta is 1%. Placenta previa is about 0.5%. Vasa previa and uterine rupture are rare causes. Abruptio placenta is painful bleeding. Placenta previa is painless bleeding. Vasa previa is painless bleeding. Uterine rupture is painful bleeding. And we're going to go through each of these one at a time. First, we always need to remember, could there be lower genital tract explanations for the bleeding, such as cervical? For instance, you could have an erosion of the cervix. An erosion of the cervix is where the epithelium is completely obliterated and you have the stroma with the vessels which are exposed, which are bleeding. This is often where you have a severe cervicitis. You could have cervical polyps. I'll show you a picture of that coming up shortly. Cervical cancer would be unlikely, but it is a possibility, and it's very easy to assess that with a speculum exam. Vaginal causes. Varicosities are common, particularly in the lower extremities and in the pelvis, and they can be sources of bleeding. Lacerations, trauma, and these can be identified and should be identified with a speculum exam. But always remember, in the late pregnancy, you want to first get an ultrasound before you do a speculum exam to rule out placenta previa, because you can get big-time bleeding otherwise. Where we will spend most of our time is looking at abruptio placenta, placenta previa, vasa previa, and uterine rupture. This is a speculum exam showing a cervical polyp. Here's a cervical polyp. And cervical polyps are really outgrowths of redundant endocervical columnar epithelium. The blood vessels are one cell from the surface, can easily bleed, but are not going to have any significant impact on the pregnancy outcome. Anytime you have a patient who is bleeding, you always need to assess, is she stable? What are the mother's vital signs? That's going to assess how the mother is doing. Is she hypotensive tachycardic? How's the fetus doing? And the best way that we have of assessing the fetus is with fetal heart tones. We'll talk about that in the chapter on fetal monitoring. If a patient is bleeding, you want to get an IV going. You're going to use a large bore IV. What size are you going to use? 16 gauge. What are you going to run in the IV? Some sort of isotonic fluid, normal saline, Ringer's lactate. How fast are you going to run it? Wide open. Put a Foley catheter in her bladder to make sure she has adequate perfusion of her kidneys. All right, she's stable. We've got the IV going. Mother's vital signs are okay. Fetal heart status looks good. We're going to get a CBC to see what her hemoglobin hematocrit is. Where is she starting out? Abruptio placenta is the main cause of obstetrical DIC. So we want to assess, could she have DIC? And we'll talk about the laboratory test for that. We want to do an ultrasound specifically to look for where there's a placenta. Is this a placenta previa? And this is my shorthand for type and cross match. T and X, type and cross match if she needs to have a blood transfusion. Our laboratory studies that we're going to look for DIC, probably the first thing which will drop is the platelets. So this will be part of a CBC. We can get a prothrombin time, partial thromboplastin time to see if these are prolonged. Fibrinogen should be elevated in pregnancy, 400 to 500, along with all the other plasma proteins. If that's low, that would be of concern. D-dimer is used for assessing DIC. And what will you see on a peripheral smear? Schistocytes, helmet cells, fragmented red cells. And here you see schistocytes, helmet cells. And that is the end of differential diagnosis of late trimester bleeding.